2026, malaria is still a major global health challenge, and it's also a leading cause of hospital visits and deaths. This is really very alarming as it affects everyone, and there is a growing case, according to WHO, of 68.5 million cases of malaria. That's a lot. And what are we doing on this show? We ensure that you stay educated, enlightened, and of course well informed of the right path to follow. So one of the things we're talking about today on the show, we're opportune to have an interview with Dr. Abimbola Oshinowo. She'll be talking to us about the factors that predisposes you to having malaria, preventive measures, and of course how to manage malaria. Plus, if you've been following us for the past few weeks, you'd have noticed that we have a segment called the Dr. Love Series. Dr. Love Series is coordinated by the CEO of Love for Health Foundation, the person of Dr. Yusuf Harun. And this week, another interesting topic on mental health. It's talking about how mental health awareness and the economy affects our health. This is one segment you wouldn't want to miss. Plus, we have an interesting report on how to identify quack medical practitioners. Very interesting one here. And Dr. Jane Wokedi was able to talk to us about what are the, what to look out for, right? When you are being treated, when you are at a hospital, what are the things you should look out for so you can identify a quack medical practitioner. My name is Nkem Okibe. We'll go on a short break. We'll take these short messages. When we return, Health Watch continues, and our first on the lineup is Dr. Love Health Series. Stay with us. We'll be right back.
Welcome to Dr. Love Series. I'm Dr. Yusuf Ademola Harun, Mental Health Awareness Part 2. Today we're going to talk about how mental health and the economy affects our daily life. We all know that things are getting very, very tough in our society based on finances, cost of living, price of food, inflation. Now again, we have to pay more taxes, both on our goods, services, and even finances, especially those people that have businesses. We should know that when we are aware of certain things, it can also affect our daily lives. Part of the things that we are going through the hustle and bustle of our daily activities is stress. Even going from our home to work is a lot of stress. Whether you are entering a bus, whether you are taking even the train, BRT, or you are even going through a car, we see the traffic every day, the noise, the disturbance, even the road, which is not good, and you have to go into potholes. All these are things that can affect our mental health. Now, in self-awareness, there are certain things that we look at. One of the things that affect our awareness is stress, and this is what we go through every day. Stress itself is acceptable, but when it is too much, it can be deleterious to our health. What are the effects that this can cause when we are having too much stress on ourselves due to financial conditions or due to workload or due to economic instability like we have in our society, the price of food is going up. This can cause stress on us and it can affect our mental condition. Part of the things it affects is that we start to develop high blood pressure, also known as hypertension. Also, we start to have lack of sleep, also known as insomnia. Another thing is that, do you know some people might even start gaining weight and you might think that they are healthy? No, they are going through stress, depression, and the cortisol level can rise in their blood and they start getting obese. I'm Dr. Love, and I appeal to the government and appeal to people who are wealthy enough that we should do more, or they should do more to support others so that we can reduce the mental health and depression in our society. Thank you very much, and always remember, we love you. Thank you, Dr. Love.
Thank you so much, Dr. Love, and thank you for educating us on how the economy can affect our mental health and, of course, how to manage it. Moving on, we had an interview with Dr. Abimbola Oshinowo. She'll be telling us all we need to know as regards to the factors that predisposes one to getting malaria and, of course, how to prevent them. Stay with us, we'll be right back. Just joining us, the program is Health Watch, your number one health program, reaching you from the station of excellence. And today we're talking about malaria prevention and management. And our guest today is Dr. Abimbola Oshinowo, the Director and State Malaria Elimination Program Manager. You're welcome to Health Watch.
Thank you so much for having me.
It's so good to have you talk about a topic that affects everyone in Nigeria. And I think in this climate, when people have fever, they just assume that they have malaria.
Yes.
So very quickly, tell us tell us about malaria. What are the factors that predisposes one to having malaria and how to prevent it?
So malaria generally is actually a disease that is transmitted, that is caused by a protozoan called Plasmodium, and is transmitted from the bites of an infected female Anopheles mosquito. So it's not all mosquitoes that actually transmit malaria. It's just that malaria, Anopheles, a female Anopheles mosquito that transmits malaria, and it's caused, like I mentioned, by Plasmodium. There are four major types. We have malaria, Plasmodium falciparum. We have Plasmodium vivax, ovale, and malaria. Then there's one that is zoonotic. It's called Nulci. It's most times found in Southeast Asia, but the one that is commonest in Nigeria is Plasmodium falciparum, and it can cause the severe form of malaria. So malaria generally is, like I said, transmitted by a vector mosquito. Now, if we can get rid of the mosquitoes, then definitely we can get rid of malaria. But mosquitoes thrive in a lot of places that many of us do have within us and out. Malaria itself is it's multidimensional. There's so many aspects to it. It affects humans. You think about the mosquito, you think about the human being, you think about the environment as well, because mosquitoes have to thrive to be able to, come up, and then they feed, because the females require blood to hatch their eggs, to harvest their eggs, and then once they get infected, then generally they transmit to other people. So we have, should I say, there are ways that we can actually increase the numbers of mosquitoes we have within us. If you look at our homes, the mosquitoes thrive, they lay their eggs in stagnant waters. Many of us do have stagnant waters at home. How? If you do not have potable water, if you don't have water coming out from your tap, most times you would have containers, and those containers are actually called breeding sites. So the mosquitoes, if they are not covered, the mosquitoes can actually go there. You have puddles of water around the homes. It's also breeding sites. Some of us have pots and pans littered in our homes. We do not want to get rid of them, or they serve one function or the other. If they want anything, can collect any form of water. You can have a small container, a small discarded container that can collect water. Sometimes you can even have leaves or plants that are wide enough to collect water. This can serve as breeding sites. And the mosquitoes do not need much water to be able to, that require much water to lay their eggs, just a little bit, and then within days, the eggs have hatched on to become adult mosquitoes. So generally, mosquitoes generally can thrive in places that they find convenient, where their stagnant waters are available.
We're talking about the 4 pillars. They are the 4-pillar campaign on prevent, test, treat, and track. What's your take on that? Tell us about it.
The 4-pillar campaigns, like it talks about, encompasses all activities that we need to do to ensure we get rid of malaria within our vicinity. The prevention part, I like to term, before I even proceed, I like to term it, if everybody can think of a pyramid, you have a pyramid. The base is actually prevention. And as you go up, you have the diagnosis, treatment. Why? Because most of the work is actually under prevention. Once you have been able to prevent malaria, the others is actually quite minimal to do. So when we look at the prevention aspect, that is where everybody comes in. That is where everybody needs to understand that you have a part to play. What are we looking at? Our nets. When we start to use our nets as we should, then definitely you are going to prevent mosquitoes.
Sorry to interrupt you. When you say our nets, do you mean the nets in the houses, or do you mean the malaria nets that we use, to prevent malaria? Because I know that Lagos is doing a whole lot of that. I had my kids some years back. I remember that when you go for antenatal, you get these kids when they are free. So when you say malaria nets, what kind of nets are you talking about?
We're talking of the insecticide treated nets, not just any kind of nets, because they have chemicals in them that actually do kill the mosquitoes when they perch on them. Those are the nets I'm referring to.
Okay.
Any way we can actually prevent mosquitoes from biting you. So the insecticide treated nets, even when you screen your homes with nets as well, they actually do have a part to play. But then the ones we are focusing on are the insecticide treated nets.
Okay.
Now, when you have them, you're expected to use them. When you use them, you reduce the amount of mosquitoes that bite, and eventually you get rid of those mosquitoes, because the mosquitoes require the blood. The female Anopheles must require the blood to be able to hatch the eggs and then reproduce and all of that. That is one aspect. Environmental management is also very key. When we think of the environment, you might assume that, well, it's government's problem, but no. If you have puddles of water around you, why don't you just fill them off? Because those puddles actually serve as breeding sites. If you have rubbish around you, or you have your dirt or refuse, ensure that you package them properly and dispose of them appropriately, because they can serve as breeding sites. Things that collect water, upturn them or cover them, depending on what it is that is being used for. Sometimes you may have some containers that actually for you. Let me give an instance. Maybe you have mortar and pestle. Okay. The mortar, just turn it over, because as it is, it serves as a breeding site. Water collects in it. Exactly. So just turn it over. Things like that around your home. By the time you do it, your neighbor does it, everyone does it. You'll be surprised at how much you've gotten rid of mosquitoes. You would even realize that the mosquitoes are not as many as they used to be. That's one aspect. The other aspect is that you want to ensure that when you do have malaria, you test yourself and not assume it is malaria. Or when you do have a fever, you test yourself first and not assume it's malaria before you start popping in the medication. Why am I saying that? There are so many causes of fever, malaria being one of them. If you remember back then, when COVID-19 was quite prevalent, it looked like malaria. A lot of people were using the medication, and they'll tell you that they're not getting any better. They can't get better because that is not the disease that you're dealing with. So, and then you don't sure where the malaria medications that we have now, one starts to get resistance to it. That's another cost implication, and a lot of things can go wrong. So when you do have a fever for any reason, ensure that you test before you treat. And then when you do have, make sure you use the recommended medication, which is a penicillin-based combination therapy. And our pregnant women, very critical. When you know that you are pregnant, go to visit the clinic for antenatal care as early as possible. And then from the second trimester, they give them sulfadoxine pyrimethamine to prevent malaria in pregnancy. So you want to ensure that all of those things are in place. Now, in terms of the track, you talked about the prevalence. When we do get the record, when we record appropriately, we know whether we're doing well or whether we're not doing well. So that information actually guides us. Is it that this particular local government or this particular health facility is seeing more malaria cases? Or the data that we obtain will give us information of what it is that is going on. So it gives us a lot of leverage in terms of information without even having to leave our seats. We are looking at our data platform. Oh, what is going on? Is it that the malaria prevalence is a lot higher here than this or that? How many people are affected? Is it that the pregnant women are the ones that are majorly affected, or is it on children under 5, or even just general public? So the track portion is to ensure that the data that we are getting, we are recording them appropriately to give us information and see how to go about any activity or intervention we need, or even which intervention to deploy in any area.
Thank you so much, Dr. Abimbola Oshinowo. Thank you for educating us on all we need to know as regards malaria, especially on the factors that predisposes one to having malaria. In this climate, it's like once you just have a headache, once you just feel fever, you conclude that you have malaria. Please don't do that anymore. You need to see a doctor. If you have any symptom or you have any sign and you feel like, oh, I have malaria, don't conclude. You need to go to the hospital and see a medical practitioner and see a doctor. All right, moving on, our next report is an interesting one. How do you identify a quack medical practitioner? Let's take this report. We'll be right back. Stay with us. According to a popular saying, health is wealth. Health is the most valuable possession an individual can have. Staying healthy is priceless. When one is sick, being treated by a quack medical practitioner usually jeopardizes the treatment process and leaves the sick worse. Quacks in the medical profession is a decay in the system that has led to the loss of many lives.
Quacks can be defined as dishonest people. They are not doctors, they are not nurses, and they claim to be doctors and nurses, which does not supposed to be.
Quackery in Nigeria's healthcare system continues to rise at an alarming rate, especially considering the harsh economy that has affected all sectors of the nation. Medical experts have identified some reasons responsible for quackery in the profession to include uninformed patients, cultural beliefs, brain drain, expensive and ungoverned healthcare.
Quacks are able to deceive their patients because of desperation. When the patients are very desperate to get treatment, so they will be able to lure them to themselves. Poverty. Some people don't have money to go to hospital, so they tend to patronize quacks.
The constant need for adequate healthcare delivery in a country with over 223 million people and few number of medical practitioners, which results to a poor doctor-to-patient ratio. This makes people vulnerable to quacks in the health system. In some cases, patients have received injections from nurses that cause harm or even paralysis.
There was once a case of a child that was brought to her facility from another facility. She was in point of correction. He was having injection abscess. The quack refused to use aseptic technique in giving the injection, and it became quite a big problem. There was a deep hole about 2 inches at the left lateral part of the buttock. Please note, a quack nurse will be the one lobbying for work, will be the one coming to your house, will be the one bringing out injections to give to you.
A quack is without credentials. They don't have certificates. They are not trained. They didn't go to nursing school or medical school. A quack will always refute what the doctor, the diagnostics and the treatment doctor have given to you. A quack always have medicine that cures all, wonder medicine, magical drugs. Now, for you to be able to dictate a quack hospital, for example, in Lagos here, the hospital must have a FEMA logo outside. Any hospital you see without a FEMA logo is not accredited hospital.
The consequences of quackery in the healthcare are devastating. However, to contain the spread, there are measures advised by medical professionals.
to reduce the quacks, there should be strict regulation from the government. Like in Lagos State, they are doing very well. The health farmers are doing very well. They are monitoring units. They are doing a very good job. They go to hospitals. They check people's licenses. And government to put into law punishment to be given to quacks. To quack doctors and nurses, there must be a punishment that will be given to them.
A healthy population is one of the nation's most valuable assets. Therefore, it is pertinent that strict regulation, enforcement of healthcare standards, public awareness campaigns are to be adhered to, as all this will help rebuild trust, improve patient outcome, and provide high-quality care to the people. And that's all we have for you on this week's edition of the program. You love to see my face every week. You love to do this with me every week. Please send the mail to us on okibe@gmail.com or call us on 0706-086-5487. Did you miss any of the edition? Did you miss the live stream? Please join us on our Facebook page, NTA Lagos Channel 10, or on our YouTube channel, NTA Lagos Channel 10. Ensure that you always reach out, see your medical doctor, see your medical practitioner each time or anytime you feel a sign you are not comfortable with. All right, don't always conclude that you have headache, that you have a fever. It doesn't always mean that it's malaria. You need to reach out, go to the hospital and take care of yourself. Remember that I normally say that health conscious people live longer. Join us again, same time, same station. My name is Nkem Okibe. See you there.